Hello, my name's Darin Seiger, and I want to welcome you to our virtual annual general meeting. I was the GP chair of NHS Nene Clinical Commissioning Group from 2011 till April 2020. So I'm here in my previous role as the chair, and for obvious reasons, we're unfortunately not able to hold our usual annual general meeting. So we hope that you appreciate the constraints that we've had, but we really wanted to share with you all the things that we would have shared if we could have held an annual general meeting. It was the right time for me to move on, and I was very pleased to be elected in a role to represent all the GPs in the Northampton locality. So I'm still continuing on in a different role for the clinical commissioning group, but we just wanted to simply welcome you to the annual general meeting, talk about a few things such as really the closing down of the Nene Clinical Commissioning Group, reflections on our highlights and the legacy that we've left behind, the locality arrangements for the new Clinical Commissioning Group, and an update on the development of what's changed in primary care. So moving forward, obviously, I just want to say a few things about coronavirus and hoping that all of you are remaining safe and haven't been touched by this horrible illness. We're actually filming this on the day after the vaccine trials have been released, so we're hopeful that we've turned the corner, but it has obviously changed everybody's life, and part of the clinical commissioning group is our top priority is to make sure that everyone is safe, including all the clinicians that work. So we've really transformed the NHS as we've all had to adapt to a new normal. And I know other speakers will be talking about that in more detail than me. So just moving on to with the predecessor organization. So NHS Nene Clinical Commissioning Group, they covered 90% of the population of Northamptonshire, that worked together with the Clinical Commissioning Group in Corby to really set up the new organization. Along with a lot of organizations that are rated now, similar to schools, the NHS clinical commissioning groups are also rated, and we came out as good by NHS England in 2019 across a number of areas, so that include quality and financial management and performance. So we were very pleased with that rating, but obviously not wanting to rest on our laurels. A few things I just wanted to highlight was our performance measures that were quite good. So the 6-week diagnostic wait, so that's the time waited by patients between referral for some investigation and having the investigation. So 99% of patients were able to access these tests, such as x-rays and ultrasounds. Our dementia prevalence diagnosis rate, which we weren't doing so well. So that's the number of patients with dementia that have been diagnosed, has improved, and then they're able to access the care that they require. No patient waited more than 12 hours in A&E for admission to a hospital bed. So we know that's a really important thing for patients, not to be stranded on trolleys. Over 98% of our patients who required psychological therapies to help with some of their mental health issues had their treatment completed within 18 weeks. So we're really pleased with that. And obviously that's super important now with all the psychological effects of coronavirus. And no patients waited more than 52 weeks for an elective procedure for the majority of the year. And unfortunately, that performance will obviously slip because of the changes that we've all had to go through, and lots of operations having to be cancelled. The challenges ahead for the clinical commissioning group at the time were patients waiting more than 4 hours in accident and emergency at both of our hospitals was a struggle, and we did not meet the targets. The ambulance didn't respond as quickly as patients should have expected. There were patients with cancer, some had to wait more than 62 days between a referral from their GP and starting treatment, so that clearly wasn't acceptable and needs to improve. Our access to some psychological therapies and the recovery rates of those patients weren't as good as we'd hoped. And the 18-week referral to treatment target was slipping even before coronavirus. So that's the time taken for patients to be referred from their GP to having their treatment was longer than we would like. And there were some patients waiting over 52 weeks for planned care, and our aim was to reduce that to 0 before coronavirus hit. So moving towards Northamptonshire CCG, so a single clinical commissioning group across the county was always part of the plan, but we had to consult our member practices. So the clinical commissioning groups are member organizations, and the majority of our member practices voted towards a single clinical commissioning group for Northamptonshire. The other big area of focus was we knew that Northamptonshire wasn't necessarily an attractive place for new doctors and nurses and various other healthcare professionals to work. So we had a big recruitment campaign to expand, particularly our GP workforce. So our legacy, so one of the things that we're really proud of is the yellow bracelet scheme. So we've done a lot of work over the years about trying to keep patients safely at home. We know that the vast majority of patients want to remain at home, but unfortunately, many patients in crisis didn't know what to do, and their only option often was to be admitted to hospital. But we've introduced this yellow bracelet scheme, so that identifies patients at high risk of admission, and that's where they wear one of those a bracelet that's yellow and that's coded with their medical information on. So if an ambulance comes to see them, they will have access to their medical notes and be able to manage the patients more appropriately. That sometimes will mean they go into hospital, but often will mean that they're able to remain at home safely. And we've reduced unnecessary hospital admissions by more than 4,600 patients in the last year. We've also developed a GP portal, we call it. So this is just an internal website where GPs and nurses have access to the latest guidance and the local pathways and services for patients in Northamptonshire. So that's a really up-to-date minute-by-minute guide on how GPs can improve the quality of care that they give to their patients. Lastly, looking ahead with the new clinical commissioning group, so we've expanded our locality arrangements across the county. So we used to have eight areas. We've now agreed 4 place-based areas. So that's in the county. If we start from the west, that's Daventry and South Northants. Then as one place, Northampton is another place. Wellingborough and East Northants is another place. And lastly, but not, is Corby and Kettering as a place. And there's been 4 locality chairs. So 3 of my colleagues, 3 GPs in those areas, are locality chairs, and they're there to represent their member practices and the local patients at our governing body meetings that we hold. Across the county, there's 16 primary care networks. For those of you who aren't aware of those, these are groups of practices that have come together to deliver better patient care across a wider population. So these are population sizes of between 30 and 80,000 patients. So we have 16 of those across the county, some at the lower end of that, of the 30,000 mark, and some very large around the 80,000. And the reason behind that was as groups of practices were able to employ more skilled healthcare professionals that work across a larger population rather than a single practice, because a single practice probably wouldn't have enough patients for them to see. So, for example, physiotherapists, clinical pharmacists, social prescribing link workers, care coordinators, and health and well-being coaches. These are people that are all there to try and help prevent illness, to keep people well, and to treat people quickly if they need their care. So I hope I've provided a brief overview of the NHS NEN Clinical Commissioning Group. And lastly, I just wanted to sign off by just remembering a patient advocate by the name, her name was Roz Horton, who sadly passed away while she was our lay member for patient and public engagement. She had a very strong sense of making sure that the patient's voice was always heard at all of our meetings, and she sadly passed away too soon. So our thoughts and prayers are with Roz's family. Thank you very much.